Good evening. We begin with a breaking update on the medical emergency that has gripped the world's attention. Today, May 10, 2026, the expedition cruise ship MV Hondias is scheduled to arrive in the Canary Islands, concluding a harrowing voyage across the South Atlantic. What began a month ago as a wildlife expedition departing from Argentina has turned into a desperate fight against a rare and deadly pathogen, the hantavirus. Tonight, we have the latest on the outbreak, the victims, and what global health authorities are doing to contain the fallout. The toll of this outbreak is devastating. As of our latest data, there are 8 total cases associated with the MV Hondias, 5 confirmed and 3 suspected. Tragically, 3 passengers have died, including 2 on board and 1 after leaving the ship in South Africa. The victims span multiple nationalities. Among the confirmed cases are a 56-year-old British expedition guide currently in stable condition in the Netherlands, and a 69-year-old British man in intensive care in South Africa, who officials say is thankfully doing better. Another suspected British case is receiving treatment in Tristan da Cunha. Dozens of passengers previously disembarked at St. Helena, and a massive international medical response is now underway. But what exactly is hantavirus? It is a rare but serious viral infection typically spread by rodents, such as mice and rats. People usually become infected not through everyday contact, but by breathing in air contaminated with virus particles from rodent urine, droppings, or saliva. The timeline of this illness is particularly challenging. The incubation period can range from 2 to 4 weeks, and sometimes even more than a month. Early symptoms mimic the flu: sudden fever, extreme fatigue, severe muscle aches, and headaches. However, as the illness progresses into the lung phase, patients can develop severe shortness of breath as fluid builds up in the lungs, alongside stomach pain and vomiting. It is a rapid escalation that requires immediate medical intervention. Currently, there is no specific antiviral treatment or vaccine for hantavirus. Instead, treatment focuses heavily on supportive care in a hospital setting. Early medical support, including oxygen therapy, fluid management, and sometimes mechanical ventilation, can significantly improve the chances of survival. Despite the severity of the disease, which carries a fatality rate of up to 40% for certain strains like the Andes virus, health experts and the World Health Organization want to reassure the public. Dr. Maria van Kerkhove of the WHO emphasizes, "This is not COVID, this is not influenza, it spreads very, very differently. Because human-to-human transmission is incredibly rare and requires close, prolonged contact, the risk to the general public remains very low. This is not a pandemic. To ensure it stays that way, health authorities have cast a wide net. Out of the 411 people associated with the voyage, including passengers and crew, 352 individuals are currently under active, daily monitoring across more than 30 countries. Authorities have successfully contacted 100% of the passengers who disembarked early. For those returning home to countries like the UK, South Africa, the Netherlands, and the United States, strict self-isolation guidelines are in place. Returning British passengers, for example, are required to self-isolate for 45 days as a precaution. Given the virus's long incubation period, health officials will be checking in regularly, and anyone developing symptoms is urged to seek immediate medical help. As the MV Hondias reaches the Canary Islands today, the immediate focus shifts to safely evacuating the remaining passengers and crew, and thoroughly investigating the origin of the outbreak on board. We will continue to monitor this developing story and bring you updates as they happen. Stay safe and good night.